The Mammography Quality Standards Act updates remind us that every mammogram report must contain one overall final assessment of findings. Hello, it's Rick, and I'd like to invite you to join me in this mini moment about the final assessment of the findings category identified in Section 900.12, Paragraph C, Subparagraph 1, Subparagraph 4, Item C, probably benign. According to MQSA regulation, when selected, this assessment must appear in the test results report as probably benign. It is defined as findings has a high probability of being benign. It should not be lost in all of this conversation that the American College of Radiology also has a report organization called the Breast Imaging Reporting and Data System. This system includes a BI-RADS Category 3, probably benign, which recommends managing specific findings with short interval follow-up breast imaging, typically using a 4 to 6 month interval to establish stability of the noted finding before issuing a conclusive management recommendation. In the real world, where your breast imaging practice operates, it is not unusual for interpreting physicians using the ACR assessment category system to include multiple BI-RADS category assessments into a single report of test results when a bilateral study is performed based on the breast imaging findings of each individual breast. However, please note, the FDA's Mammography Quality Standards Act states that all breast imaging practices are required to comply with this guidance when reporting mammogram results. Overall final assessment of findings classified in one of the following categories. The assessment statement is only the word or phrase within the quotation marks. This refers to incorporating a single overall final imaging assessment for the mammogram using one of the categories provided in MQSA's lexicon and the specific wording provided in the regulations when reporting the assessment selected. According to multiple studies and clinical guidelines in breast imaging, probably benign as the final assessment indicates that the mammographic findings have a high probability of being benign but warrant short-term follow-up and accounts for approximately 10 to 15% of all mammographic assessments. For the patient, a probably benign assessment alerts them that the mammogram being reported includes findings that are not clearly benign, but not suspicious enough to necessitate immediate biopsy, but does warrant monitoring it in some shorter interval than an annual mammogram in order to detect any changes over time. It should be recognized that this assessment can lead to some degree of anxiety for certain patients. So, the breast imaging practice has the opportunity to address their peace of mind and overall well-being by incorporating tools to assist in obtaining follow-up appointments and keeping them well informed. Next, an overall final assessment of probably benign provides transparent and standardized terminology for referring clinicians and other healthcare providers to understand the results, reducing the risk of misinterpretation. Third, it helps set a structured follow-up plan, typically within 4 to 6 months, ensuring vigilant monitoring without causing undue alarm or unnecessary interventions. As with other final assessments, the probably benign assessment was the subject of several regulatory comments and responses during the review process. A point raised in the final updated regulations is the distinction between the required assessment statement and the explanatory language. The FDA noted that the explanatory language is meant for internal use by interpreting physicians and facility personnel, rather than for inclusion in patient reports or lay summary letters to the patient. Another comment recommends that the FDA provide examples of when a self-referred patient receives an assessment, such as probably benign, where access to a healthcare provider is required to obtain the referral mammographically warranted for a short-term follow-up as recommended by the interpreting physician. For clarity, the FDA revised the final provision to state, each facility that accepts patients who do not have a healthcare provider shall maintain a system for referring such patients to a healthcare provider when clinically indicated, which shall include when such patient's mammogram assessment is either probably benign, suspicious, or highly suggestive of malignancy. You can dive into all the details about this part of the updated regulations in Section 900.12, Paragraph C, Subparagraph 2, Subparagraph 2. Ultimately, the probably benign assessment is vital in mammography reporting, balancing vigilance and avoiding certain unnecessary procedures. By offering an intermediate risk category, it supports precise clinical decision-making, ensuring appropriate follow-up and optimal resource use while maintaining clear communication among healthcare providers. By understanding this assessment category's role in the MQSA lexicon of overall final assessments available to select from and its implications, healthcare providers can make informed decisions and effectively communicate with patients, ultimately improving the quality of care in breast imaging. If you like this, please give it a like. Also, make sure to subscribe for more bite-sized information about other mini moments. Do you have an opinion or idea about something you want to hear about? Be sure to leave us a comment. To get references to the information used here, check out the link to our Knowledge Hub below. Until next time, continue striving to enhance patient outcomes by delivering compassionate and precise breast imaging care.